You can think of it like a computer that's learned all of the patterns in a given language and a given body of information. In this case, ChatGPT is more or less the whole scope of the internet. We ask it questions in a conversational way, and it gives us an answer that reflects all of that data. The most basic question we might ask about breast cancer is, what is my risk for breast cancer? Let's see what ChatGPT has to say. All right, it's thinking. All right, so this is good. It's giving a disclaimer about its limitations. It can't tell you about your personal risk for breast cancer, but it can give you these general risk factors, things like age, family history of breast cancer, lifestyle factors, and that all checks out from a medical standpoint. And what we found was somewhere close to 90% of responses were actually appropriate, which was a good thing. But that 10% that were not appropriate, either ChatGPT gave inconsistent responses, meaning if you asked it on any given day, you'll hear different answers that often contradicted each other, or the responses were just flat out wrong. Our language, unfortunately, in society and the internet often has these racial biases with even how we describe patients. So you can imagine you put in the same patient scenario, but you take out a different race or put in a different race, the recommendations may be totally different. I think that these pitfalls indicate ChatGPT's got a lot of potential, but it's not ready for prime time. And there's a lot of work that needs to be done that I think requires collaboration between computer scientists like at OpenAI who developed ChatGPT, as well as with doctors who can say like, hey, if we're gonna roll this out and let patients use it, we need to make sure there are these guardrails.